This committee will come to order. I want to thank our nominees, Mr. McKernan and Dr. Adams, for being here today. Congratulations on your nominations, and thank you both for your willingness to serve. Today, we will first hear from Jonathan McKernan, who is nominated to serve as the Undersecretary for Domestic Finance at the Treasury Department. The Domestic Finance Office develops policies and guidance for Treasury Department activities in areas involving financial institutions, federal debt finance, financial regulation, and capital markets. Sensible guidance in these areas better ensures financial stability and the growth and resilience of our economy. Mr. McKernan has demonstrated a track record of support for sound and balanced regulation. As a member of the Board of Directors at the Federal Deposit Insurance Corporation, Mr. McKernan opposed burdensome rulemakings such as the Basel III Endgame proposal, which would have hindered economic growth and reduced lending to households and businesses in America. He also served in senior advisory roles on the staff of the Senate Banking Committee, the Federal Housing Finance Agency, and the Treasury Department. Mr. McKernan, I look forward to working with you, if confirmed, to bolster and protect our domestic financial system. We will also hear from Dr. Alex Adams from Eagle, Idaho, a great place, who is nominated to serve as the Assistant Secretary for Family Support, which oversees the administration for children and families at the Department of Health and Human Services. ACF plays a vital role in supporting some of America's most vulnerable populations, including foster care and adoption assistance, both of which have garnered bipartisan support from this committee. It is imperative that this agency is led by someone with a deep understanding of these complex issues, a commitment to sound fiscal management, and a proven track record of delivering results. Dr. Adams' service as the Director of Idaho's Department of Health and Welfare has prepared him to lead the ACF. He's overseen a staff of nearly 3,000 individuals and an annual budget of $5.5 billion and delivered clear results for Idahoans. As Director, Dr. Adams placed a strong emphasis on child welfare, working with the Idaho State Legislature to enact laws to extend foster care to age 23, allow kin-specific licensing standards, and enhance time to permanency. Dr. Adams also has a strong record on the budget and efficiency, having served as Governor Little's Budget and Regulatory Director. He's demonstrated a keen eye toward fiscal responsibility, reducing regulatory burden, and maximizing the impact of taxpayer dollars. This experience will be invaluable as he oversees the varied programs under ACF's purview. His nomination has also received letters of support from a broad range of different stakeholders, which I request to be entered into the record without objection. Thank you again to our nominees for their time today. And with that, I recognize Ranking Member Wyden for his opening remarks.
Thank you, Mr. Chairman. Joining the committee are Alex Adams, nominated to serve as Assistant Secretary for Family Support at the Administration for Children and Families. They're known as ACF. Jonathan McKernan, nominated to serve as Undersecretary of Domestic Finance at the Treasury Department. The Administration for Children and Families is responsible for America's well-being of children and families. So I'm going to just do a quick rundown on where things are 6 months into the Trump presidency on those issues of health and safety. More than 15 million Americans, 15 million, are about to lose their health care so that there'd be tax breaks for the ultra-wealthy. Robert Kennedy has fired scientists and experts to put anti-vaccine quacks in charge of vaccine safety. He told this committee months ago he would do no such thing. The United States is currently suffering its worst measles outbreak in 30 years with 1,300 cases, 1,300, and still counting. The workforce and funding for agencies and programs that are designed to keep the American people safe and healthy have been gutted. In short, Donald Trump, Mr. Kennedy, and congressional Republicans have worked overtime. They've used their time for policies that make America weaker, sicker, and poorer. Now, that brings us to Dr. Adams. My team has been talking to advocates on the ground in Idaho, and it would be an understatement to say that they're alarmed about what has been going on in that state, in his state, harming vulnerable children, families, and people with disabilities, and that actions that he has been supportive of, if confirmed nationwide, would cause children to suffer. Now, he is a proponent of deregulation at any cost, what he and other elites call zero-based regulation. But let me put this in English, folks. I was director of the Gray Panthers and senior citizens for about 7 years and listened to all this government talk. When I hear zero-based regulation, it tells me there are no guardrails. That's what we always want in policy. We want people to have the freedom to make as many choices as they possibly can that are theirs and their families. But we got to have some guardrails. And we have been looking at some of what has happened in Idaho, and particularly lowering safety standards in licensure for kids with disabilities. So the person in charge of ACF is responsible for overseeing Head Start programs that are struggling right now to keep their doors open due to funding uncertainty. This person is responsible for making sure that there are basic health and safety rules for child care in America. This person is responsible for the protection of unaccompanied immigrant kids who now languish in detention, while Donald Trump co-opts the Child Welfare Agency for immigration enforcement. On top of this, ACF for the first time is going to be responsible for senior nutrition, something I care deeply about from those Gray Panther days, and protection and advocacy for seniors and Americans with disabilities, among other critical services for our communities. In the fallout of the HHS mass firings, more responsibility with fewer staff certainly has the potential for significant harm. Heading up ACF is a big job centered around keeping kids and communities safe. It goes without saying that America's children deserve a person who's going to follow smart and basic science, somebody who's going to go to the mat to keep kids healthy and safe no matter what their faith, their immigration status, or how they identify. And as we listen to people who have been on the ground in Idaho and elsewhere, this is a nomination that hasn't inspired confidence at this point. Let me turn to Jonathan McKernan's nomination to serve as Undersecretary of Domestic Finance at Treasury Department. There is Mr. McKernan. Appreciate him being here. If confirmed, he'd play a major role in how the federal government organizes its debt and how Treasury handles the most sensitive data of American taxpayers. Over the last few months, who has access to that data and how it's been handled has been called into serious question as DOGE and its rogue employees wrestled to get their hands on this sensitive information. This committee has played a leading role in talking about what's been going on at DOGE. In fact, it was our committee investigators who blew the whistle when the Treasury Secretary, Scott Bessent, gave away early on the keys to the kingdom, the keys to this Fort Knox of data. And Donald Trump and people around him are weaponizing federal agencies to go after free speech and the people and groups that they disagree with. So what's needed in this role is a person who's going to stand firm against the Trump campaigning of chaos and corruption. So we'll look forward to hearing from Mr. McKernan on how he intends to stand up to that kind of bedlam if he's confirmed. Thank you, Mr. Chairman.
Thank you, Senator Wyden. In a moment, Mr. McKernan and Dr. Adams will share their opening statements. Before doing so, I will provide a short introduction of both nominees. Mr. McKernan served on the board of the directors of the Federal Deposit Insurance Corporation from 2023 to 2025. He also served as a senior counsel at the Federal Housing Finance Agency, a senior policy advisor at the Department of Treasury, and a senior financial policy advisor to Bob Corker, senator from Tennessee. Prior to his government service, Mr. McKernan was an attorney in private practice focused on banking and consumer financial laws. Dr. Adams, as I've indicated, currently serves as director of the Idaho Department of Health and Welfare. Prior to leading that department, Dr. Adams spent more than 5 years as Governor Little's budget and regulatory director. He's also served as executive director of the Idaho Board of Pharmacy. Mr. McKernan and Dr. Adams, before you give your opening statements, I have 4 obligatory questions that we ask all nominees before the Senate Finance Committee. First, is there anything that you are aware of in your background that might present a conflict of interest with the duties of the office to which you've been nominated?
No, Chairman.
No.
Second, do you know of any reason, personal or otherwise, that would in any way prevent you from fully and honorably discharging the responsibilities of the office to which you have been nominated?
No, Chairman.
No.
Third, do you agree without reservation to respond to any reasonable summons to appear and testify before any duly constituted committee of Congress if you are confirmed?
Yes, Chairman.
Yes.
And finally, do you commit to providing a prompt response in writing to any question addressed to you by any senator of this committee?
Yes, Chairman.
Yes.
With that, we will begin with your opening statements. Mr. McKernan, you may go first, and each of you, please feel free to introduce any family or friends who are here with you. Mr. McKernan.
Thank you. Thank you, Chairman Crapo, Ranking Member Wyden, and members of the committee for this opportunity to appear before you today. It is a great honor to have been nominated by President Trump to be Undersecretary for Domestic Finance. I'm grateful to the President and Secretary Bessent for this extraordinary opportunity to serve our country and help advance the President's pro-growth agenda. I am joined today by my parents, Patrick and Victoria, who are here from East Tennessee, as well as my brother, Paul. I am deeply grateful for their love and support. My wife, Sapna Sharma, is watching from home as she cares for our 2-week-old newborn. 8 years ago, Sapna and I met on the Hill when we were both starting out as congressional staffers. Today, we're both still in public service, and now we have 3 little boys. I should also acknowledge and just express my appreciation to my mother-in-law, Krishna Sharma, who's been staying with us since the birth of our newborn. Just an incredibly helpful person to have around the last 2 weeks, and thank you, Krishna. A newborn in the house certainly refocuses the mind. Like those who came before us, we're all stewards of the American experiment for future generations. That responsibility calls for us to safeguard the moral foundations of our great nation, the dignity of the individual, ordered liberty, rule of law, limited government, free markets. If confirmed, I will endeavor to honor that responsibility by also considering the interest of the many Americans yet to come. As a very practical matter, I believe that means a focus on domestic finance policies that promote economic growth. Economic growth is not just about material well-being, even if that's important in its own right. Growth expands opportunity and human potential while making us forward-looking and generous. Growth empowers us to defend our interests abroad while positioning us to honor our promises at home. And perhaps most importantly, growth gives us the means and optionality to navigate the threats and challenges that the future inevitably has in store for us. Stagnation, by contrast, is not stationary. As we can see when we look across the world, stagnation stokes division, suffocates ambition, and breeds despair. We can preserve this great nation, its confidence, its optimism for future generations if instead we choose an attachment to sustainable economic growth as a moral imperative. To that end, if confirmed, I will champion reforms that foster growth both within and outside our banking system. As the Secretary has said, President Trump has a generational opportunity to usher in a new, more balanced era of prosperity that will lift up all Americans and rebuild communities and families across the country. The Office of Domestic Finance has a wide ambit spanning financial institutions, financial markets, and financial stability, all of which have a role to play in creating more jobs, wealth, and prosperity for all Americans. Another key role is to manage the cost of financing the federal government. The Treasury market is the deepest and most liquid in the world, and it must continue to function well even during periods of stress. I believe my 17 years in financial services law, regulation, and policy have prepared me for this challenge. Over the past 2 years, I served as a member of the FDIC's board of directors. Before that, I held staff roles in the Senate, the Treasury Department, and the FHFA, all focused on the mortgage market and broader regulatory issues. Before public service, I spent more than 9 years as a lawyer focused on banking and consumer financial laws. Through these experiences, I've developed the expertise and broad perspective necessary for this role. It is a great honor to be considered, and I look forward to your questions.
Thank you. Dr. Adams.
Thank you, Chairman Crapo, Ranking Member Wyden, members of the Senate Finance Committee. Thank you for the opportunity to appear before you today and for considering my nomination to be Assistant Secretary for Family Support. I'm honored by President Trump's nomination, and I'm deeply humbled by the confidence placed in me. I look forward to working with President Trump, Secretary Kennedy, and all of you to make America healthy again. Before I begin, I'd like to thank my wife, Jen, who's joining me today from Eagle, Idaho, and our beautiful 6-year-old daughter, Emerson, who's watching from home and hoping that this wraps up before Bluey. I'm grateful for my family support. Families are everything, and that's why I'm here. Simply put, every child deserves a family, and every family should have pathways to opportunity. My route to this nomination is through state government leadership. Over the past decade, I've been entrusted to lead 4 distinct state government agencies spanning health professional regulation, education innovation, state budgeting, and health and human services. This broad-based public administration experience has prepared me well for the responsibilities of leading ACF, and it's equipped me with the collaborative leadership necessary to drive meaningful change. I'll bring a state view to federal policymaking at a time when President Trump has called to revitalize federalism. My current agency administers over 100 federal grants, many under ACF's purview, giving me firsthand insight into the careful balance needed between state innovation and federal oversight. Simply put, I believe federal policy should seek to empower, not diminish, state and tribal governments to meet the unique needs of their communities. And I believe federal policy should strengthen, not supplant, parents' capacity to make the best decisions for their children. I'll seek to provide states, tribal governments, and parents maximum flexibility under the law. 2 experiences have shaped my approach. First, I served as Idaho's budget director, our equivalent to the OMB, where I developed statewide budget recommendations with our governor. I'm most proud we achieved a AAA credit rating for the first time in Idaho's history, grew our investments in public education, and built our reserves to the largest balances in Idaho's history. As you well know, budgeting involves tough choices and trade-offs, but this experience instilled in me a deep respect for the connection between fiscal health and family well-being. If confirmed, I'll bring a budget-conscious, outcomes-oriented approach to stewarding taxpayer dollars. Second, in leading Idaho's Health and Human Services Agency, I've had the privilege of engaging with some of the most complex human challenges in state government. These challenges are much more than numbers on a budget spreadsheet. They're real people. And despite the polarization in today's politics, I found that child welfare remains a bipartisan cause. I worked with our legislators on both sides of the aisle to strengthen kinship placements, accelerate permanency timelines, extend foster care to age 23, and make record investments in child welfare prevention, all with broad bipartisan support. These reforms echo the spirit of the landmark Family First Prevention Services Act that President Trump signed, and most recently, the Supporting America's Children and Families Act, signed by the previous administration. These are not Republican or Democrat issues. They're simply the right thing to do. I agree with President Trump when he said the best foster care system is one that is not needed in the first place. If confirmed, I look forward to advancing this work with President Trump, with Secretary Kennedy, and with all of you, and partnering on shared priorities, including accelerating evidence-based prevention services in child welfare, recruiting and retaining qualified foster families, speeding time to permanency for children who are eligible for adoption, improving outcomes for youth who are aging out of foster care, increasing access to high-quality, affordable child care and strengthening Head Start, promoting upward mobility and breaking generational cycles of poverty, reducing administrative burden on states and tribes while upholding accountability. I know that together and only together can we make a difference on these issues and more. So I wrap up, Mr. Chairman, I'd be remiss if I didn't note ACF's Idaho roots. Its oldest program, the Children's Bureau, was enacted in 1912 on a bill spearheaded by Idaho's own Senator William Borah. I'd be honored to carry on this legacy. Thank you again for the opportunity to appear before you today. I'm deeply honored by the nomination, and I request respectfully your support. And I look forward to working with you. Thanks for the time this morning. I look forward to your questions.
Thank you. First, I will ask Mr. McKernan my question. Mr. McKernan, given the growing complexity and overlap in regulatory requirements for financial institutions, how will you streamline oversight and reduce unnecessary burdens if confirmed?
Thank you, Chairman. I think you're exactly right. We need to continually revisit our financial regulatory framework to ensure that it is aligned with the actual risks that we're trying to regulate. And key to that is tailoring regulation to the risk profile associated with whether it's the financial institution or the capital markets activity that we're looking at. But tailoring, I think, really is a guiding star here.
Thank you. And Dr. Adams, some mention's already been made about the zero-based regulatory approach that you have pursued, but the implication seems to have been that eliminated protections for children or those who are disabled. Could you address that question?
Yeah, Mr. Chairman. First, let me talk about what zero-based regulation is. It is something that was born out of democratic priorities. We saw it, we found it first in a 1978 campaign speech from former Senate Finance Chairman Max Baucus. President Obama's nominee, Penny Pritzker for Commerce, talked about zero-based regulation during her nomination process. So born out of both parties. What we did in Idaho is we flipped the presumption that regulations should continue by default. There's a phrase, regulations rise like rockets but fall like feathers. We said we need to look at each regulation every 5 years. We need to challenge the presumptions underlying them, and do they still make sense? The way we set it up in Idaho, it was a bipartisan approach. We worked with everyone from the AFL-CIO to industry, as you'll see in my letters of support, and we did it the right way. We found those regulations that weren't needed. Maybe we don't need to regulate snails that don't exist in our state. Maybe we don't need a lottery game show regulation that never aired. And we got those silly, outdated, gunky regulations off of the books so that we could shine a brighter spotlight on what remains. And I'm not sure what regulation is being referred to, but I think you would be hard-pressed to find a specific Idaho regulation that has resulted in harm because of the approach taken in Idaho and the safeguards put in place, including public comment.
Well, thank you very much. And I just want to give you an opportunity to make it really clear that in Idaho, we take care of our kids and those who are disabled and those who are in need, and that the regulatory activities that we undertake to keep our regulatory burden low does not reduce the protection for those people who need it. Is that a fair assessment?
A fair statement, Senator.
Thank you. Senator Wyden?
Thank you very much, Mr. Chairman. Dr. Adams, do you agree with Secretary Kennedy's approach to dealing with the measles epidemic? And I would like a yes or no answer. I know time is short and you and I got a lot of stuff to cover. Do you agree with Senator Kennedy, the Secretary's approach to the epidemic?
Senator Wyden, as we talked previously, there's more measles cases in Mexico and Canada. So we've had one case in Idaho. It was a Canadian who flew into Salt Lake, drove up to Idaho, sequestered, generally compliant.
I asked, do you agree with Secretary Kennedy's approach to the measles epidemic? We have the highest number in 30 years. That's why I'm asking for a yes or no answer.
Senator Wyden, I was describing our case in Idaho. We got white glove service from the CDC. We were very grateful for the federal support that we got. Secretary Kennedy has advocated for the MMR vaccine as the most effective way of preventing the spread of measles, and I agree with that.
I asked you twice to tell me whether you agreed with his approach on the measles epidemic, and clearly you do. And I think that is bad news for America's kids and families. So let's talk about the residential treatment facilities that you and I talked about. As you know, and I gather you read our report, Warehouses of Neglect, it finds that federal restraints and seclusion regulations are often overlooked, that there's often unqualified trained staff, and it's hard to have the oversight that's necessary. So my question here is, what are you going to do specifically to stop kids in residential treatment facilities from getting hurt?
Senator, I appreciated our conversation on this the other day. I think it's an area where you and I have a lot of thoughts that align, and I look forward to working with you on this topic if confirmed. What we did in Idaho was we followed the lead of your Warehouses of Neglect report, as well as the spirit of the Family First Prevention Act. We want to use congregate care as a tool of last resort, and for the shortest amount of time, only when it serves a therapeutic purpose. When I started at our state HHS agency, I had 268 kids in congregate care. Today, I have 173. We reduced congregate care 35%. We talked about regulation and zero-based regulation. Another way of saying it is right touch regulation. We want the right regulations where they make sense.
I'm still not clear what you're going to do to keep kids from getting hurt in these facilities. Like, for example, would you use independent investigators to make unannounced visits to facilities if there was some concern that the kids weren't getting decent care?
Senator, so the licensing of residential facilities is at the state level. There's three ways in which these facilities intersect with an agency like mine. There's licensing, Medicaid providers.
It's just a policy. I want to get a sense, because when you talk to me, you made it out like you were up and down supporter of the work that we've been doing. Now, if you find out you agree with Robert Kennedy about, measles, I want to find out what you do if there was a facility that was, problematic, whether there'd be unannounced inspections. And so why don't you answer that question, if you would?
Senator, I'm building up to that. So we have Medicaid provider agreements as well as child welfare contracts. What we do is, since I started, we went from one announced inspection a year to 2 inspections a year, including 1 unannounced. We now randomize the inspectors in Idaho, and the reason we do that is there's no greater need than to protect the most vulnerable kids, and the most vulnerable kids are those in congregate care settings. So I do believe those are very appropriate decisions for states to make. I think the role of ACF is to follow the spirit of Family First, provide best practices, provide guidances to states, and then I think through the 4E dollars as well as the Medicaid dollars.
Answer my question. I believe you have said on occasion you use an unannounced inspection. Is that right?
That is something new that we've done in Idaho since I started.
I have one last question, and my time's going to be up. We're adding to the report that you read that sets out specific abuses against LGBTQ young people that we have been able to document. We've collected over 100 personal stories, and it's clear these kids suffer from extreme isolation in facilities. They get verbally abused. Often they face things withheld from them that doesn't apply to other young people. What would you do to make sure that the laws are complied with and they're treated with dignity?
Senator, it's simple. All kids deserve respect and dignity.
So what would you do, though, given the problems that we've documented? Would you make special efforts to reach out? I mean, you are very articulate. You were very articulate in the office, but it's really hard to understand what you stand for and what you would do. These are kids who are being discriminated against now, right now. 100 cases, we've documented them, and you say all kids deserve, a fair shake, but I don't know what it is you would do to make sure they got one. So why don't you take one more crack at that?
Senator, my operating principle in Idaho has been when there's a fork in the road, I'm going to do what's in the best interest of the child. Not knowing the cases, I'd be happy to review those cases. But following the best interest of the child and ensuring all kids are treated with respect and dignity and protected from harm and following the law is my operating principle.
Thank you, Mr. Chairman.
Senator Hassan.
Thanks very much, Mr. Chair, and thanks to both you and Ranking Member Wyden for this hearing. Good morning to our nominees. Congratulations on your nomination, and congratulations and thanks to your families as well. To both of you, I want to start with a very simple question. If directed by the President to take an action that would break the law, would you follow the law or follow the President's directive?
Senator, I'm going to follow the law. It's always going to be my North Star.
Thank you. And Dr. Adams?
Senator, I know that wouldn't happen, but I would follow the law.
Thank you. I would suggest that you review current events and past events to determine if you don't think that will happen again, but I do expect you to follow the law. Thank you very much. Dr. Adams, many states struggle to recruit and retain foster families to care for the nearly 200,000 children who enter foster care each year. Senator Grassley and I have a bipartisan bill called the Recruiting Families Using Data Act, which would help states develop and implement a family partnership plan to tackle this challenge. Dr. Adams, if confirmed, will you commit to reviewing this legislation and working with us to improve recruitment and support for foster families?
Senator, as I said in my opening statement, recruiting and retaining foster families is one of the absolutely critical things that we need to do as a country. When I started in my role in Idaho, I had too few foster families, and as a result, we had kids sleeping in Airbnbs, short-term rentals, and other non-traditional settings. Through retention and recruitment efforts, last November, we got every kid out of a short-term rental, and I said we're never, ever going to do that again. So any effort to recruit or retain foster families, I think, is worth taking a look at, and I'd be happy to work with you if confirmed in reviewing that.
Well, thank you. It's a really critical thing, and of course what we want to do is recruit and retain really strong foster families for these kids and provide long-term relationships and care and reunification when we can. Dr. Adams, if confirmed, you'd also be responsible for overseeing programs critical to early childhood care and learning, including the Head Start program. Head Start programs have weathered a storm of chaos since the Trump administration took office. This includes delayed reimbursement payments, additional and unnecessary bureaucratic red tape, and communication failures caused by staff layoffs. As a result, many Head Start centers have been forced to question whether they can keep their doors open, and the families that they serve fear that they will lose their child care. I'll also just note, when I sit and talk with Head Start leaders and teachers in my state, they all tell me, of course, the difference that the Head Start program makes for the children, and that's, of course, the most important focus, but the additional difference it makes in the lives of the families as they engage with the Head Start staff and begin to build a better life for themselves with the support that Head Start provides their children, but also the connections that the Head Start staff really makes. So will you reverse the administration's actions that have harmed children in Head Start?
Senator, thank you for the question. First, let me just say Head Start is a program that's personally important to my family. My wife, who's joining me today, her grandmother ran a Head Start program in Blackfoot, Idaho in the late 60s, early 70s. So I would echo what Secretary Kennedy has told the committee, which is his goal is to make Head Start better and brighter by the end of this administration. I'm eager, if confirmed, to roll up my sleeves and work with you and others to ensure that that happens.
Well, I am pleased to hear that. I am concerned because, of course, the actions of the administration that Secretary Kennedy appears to have supported has really wreaked havoc in the Head Start community. And I'm hearing from a lot of folks there, I mean, you know, showing up to work and not having your badge be able to open the door because the administration has just shut the office is not a way to treat workers we value, who are often underpaid and who are doing the critical work of helping our kids. So I hope you will look at reversing those actions. And you have a lot of people on both sides of the aisle who would like to partner with you on really strengthening Head Start. Mr. McKernan, if confirmed, you would be responsible for overseeing the Office of Capital Markets, which is directly involved in developing and implementing policies aimed at improving the housing market. What actions will you take to improve the supply of affordable and accessible housing across the country?
Thank you, Senator. Appreciate the question. Been working on mortgage finance issues, it seems like the better part of 6, 7, 8 years now, and certainly an issue near and dear to my heart. I think when we think about the affordability challenges on home ownership, you're exactly right. It's all about increasing supply.
Right.
Part of the solution there, it's an issue with many aspects to it, including zoning and others. Part of it is also, as you point out, funding for that. And so we need to, in my view, have both banks, housing finance entities, other sources of capital supporting supporting the build out of supply. So that would be something I would certainly be looking at if confirmed. Again, is to ensure we have a diverse set of funding sources for supply of housing.
Thank you. It is probably the issue that I hear most about from my constituents from all walks of life and businesses of all sizes, to the point where we can't even sometimes recruit employees, even executives, to New Hampshire because of the lack of housing stock. So there's a lot, again, of us on both sides of the aisle who are eager to work on that. Thank you.
Usually doesn't work this fast. Mr. Adams, as you know, Senator Hassan shared from your recent works to champion foster parent recruitment in Idaho. There's a significant need for qualified foster families. This is related to recruitment and retention efforts that aren't working, as well as how the states are developing their diligent recruitment plans. You referred to my bill, Recruiting Family Using Data Act, would address the recruitment challenges by modifying the diligent recruitment plans to improve data collection so the scope of the challenge that the states may face is better understood. Do you agree that better data collection will help improve recruitment efforts established by these recruitment plans? If yes, say why.
Senator Grassley, thank you, and thank you for your longtime advocacy in support of foster care, including the creation of the caucus here. As I said in my opening statement, recruiting and retaining qualified foster families is absolutely critical. In Idaho, we took a data-driven approach to that, so I do think having states oriented around data is going to be critical. When I started, we had too few foster families. When you asked anyone how many, it was an unquantifiable number. We just needed more. So what we did is we set a target. We have a target. If you walk into our offices today, you'll see our goal is I want 150 foster families for every 100 kids coming into the system. I wanted families waiting on kids. I didn't want kids waiting on families. So every week I look at a breakdown of our data by region, and I get a ratio of the number of foster homes relative to the number of foster kids. When I started, we had 74 foster homes for every 100 kids. Today we have 95 foster homes for every 100 kids that have come into place. We've done that through data, targeted outreach, but in addition to recruitment, retention is one of the most important things states need to focus on. Retaining your existing crop of foster families through providing top-notch services, involving them as part of case management and case planning is something that's really important.
Yeah. Also, on May the 5th this year, I wrote Secretary Kennedy about the National Human Trafficking Hotline and the contractor operating it, Polaris. I noted that a whistleblower disclosed that Polaris isn't reporting tips of human trafficking to law enforcement. This includes reports about minors. I also highlighted that Cather Schoen, the co-founder of Polaris, is in charge of the Office of Trafficking in Persons. That office oversees and awards the grants to run the hotlines. It's my understanding that the OTIP and HHS are set to award the grants soon. Given that you'll oversee OTIP, will you ensure all conflicts of interest are removed from the grant process? And if so, how do you do that?
Senator, first, I've read a little bit about this issue through published reports, but as the nominee, I don't have any internal information. First, I would say with the human trafficking hotline, any relevant tip should be and shall be transferred to law enforcement, period. I understand the Trump administration has made positive steps towards that, and to the extent that that issue is not fully resolved when I start, I will commit to working with all relevant parties to solve that. All tips should go to law enforcement if they are relevant tips. In terms of procurement integrity, it's absolutely paramount that people have trust in how our government operates. And to the extent there are any conflicts of interest, I would work with our Office of General Counsel and the other relevant parties to issuing a procurement to ensure that it is done within the confines of law.
To emphasize, then, can I get your commitment to ensuring that all tips are required to be reported to law enforcement will actually be reported?
Senator, yes, all relevant tips will be reported.
Thank you. I yield.
Senator Langford is next.
Thank you. Gentlemen, thank you both. This is a tough process to be able to walk through, and so I appreciate you stepping in to be able to do this. Mr. McKernan, I want to be able to start with you. I have a lot of community banks that are in my state. It's incredibly important for the small businesses in our state to have access to capital, but the capital requirements are different for community banks than they are for big banks as far as their leverage ratio. There's a standard between 8% and 10% leverage ratio for community banks. They sit at 9% right now. During COVID, it was 8%. They all did fine during that time, during that stress time on it. It would open up access to a lot of capital for that leverage ratio to go to 8%, which is allowed. And it still doesn't equal what the big banks' leverage ratio is. They've got even more generous leverage ratio. So what I'm trying to figure out is to get greater ability for community banks to be able to thrive, make loans to small businesses in their communities. What's your concern on something like that, or do you have a concern?
No, Senator, no concern. I think you've raised an important issue here. Obviously, the banking agencies will have to make the decision on whether to revisit the community bank leverage ratio. But from a Treasury perspective, if I'm confirmed, I would certainly be advocating for a fresh look at this issue. As you say, we've really got to have a financial regulatory system that preserves a central role for community banks in the financial system of the future. And this may be one change we can make to facilitate that.
That'd be helpful. So community banks are always afraid of growing. And it drives me crazy that we've literally got a cap on certain businesses, banking, to say if you grow too much, then we're going to find ways to be able to punish you with more examinations, and try to be able to literally slow it down. So a lot of our community banks, when they start growing it, they begin to approach $10 billion. They know they're about to get a bank examiner living full time in their bank because of the rules. Again, these are discretionary rules. That $10 billion number was set a long time ago for being a big bank examiner. So if they want to keep an examiner out full time out of their bank on it and have a whole department that has to open up based on that, they need to be smaller on it. I just think that's a problem on it. Again, I'm not going to ask you to commit to that, but I think it's something we need to be able to look at. One of the things I do want to be able to talk about is in the last 2 decades, thankfully, we've not had a lot of bank failures. We continue to have strong banks around the country. But just a few years ago under the Biden administration, when Silicon Valley failed, they had a full coverage for that, everything. But at a small bank in Oklahoma that failed, and they said, tough luck. And it became clear that if you're well connected to the administration, they're going to make sure all your folks are covered, including Chinese investors that were in Silicon Valley. But if you're a bank in Oklahoma, it's a different standard. What that creates is instability across the country where businesses don't want to invest in community banks because they don't know whether they're going to be made whole like it is on regional banks or a big bank. So you start pushing capital out. You know this well. We got to figure out a way to be able to find some system under FDIC to give stability to communities and community banks and small grocery stores and churches and those folks that put their dollars there to be able to know that uninsured or non-interest bearing accounts are still going to have some kind of coverage there so we don't have a flee of capital there. How do we solve that?
Senator, this is an issue I think it's fair to say near and dear to the Secretary's heart. You're absolutely right. There is, I think, a market perception, contrary to law, that uninsured deposits at large banks are safer than they are at your local community bank. That can tend to create a system that actually entrenches the largest banks and disadvantages the community banks. One idea the Secretary has floated, I think he's very eager to see continued discussion on, is actually lifting the cap on deposit insurance for business payment accounts. That would actually obviously require legislation, but I think that would go a long way to leveling the playing field with respect to the deposit franchise and ensuring, again, that we have a central role for community banks in the financial system of the future.
That's great. Thank you. Dr. Adams, I just want to be able to bring up a couple of quick things with you. One is previous administration for ORR, the Office of Refugee Resettlement, when unaccompanied minors came across the border, they were often placed in homes that the sponsors were not vetted for criminal background check, nor were they actually asked even if they were legally present in the country. We now have tens of thousands of kids we can't find, and we don't know the background of the sponsor they were handed over to. Trump administration is actively looking for those kids now that were just given to people that were not properly vetted, nor were they legally present in the country, and they've absconded. Policy-wise, what would you want to be able to see on that for a child coming across the border? If they're put in a sponsor, do they need to be legally present in the country and need to be fully vetted?
Yeah, simply put, the previous administration prioritized speed over safety. We will prioritize safety over speed and ensure that the best interests of these children are front and center in every decision that's made.
Thank you for that.
Let's see, Senator Marshall.
Well, thank you, Chairman, and welcome again to our guests. I wanted to start just for a second and maybe correct some of the testimony or some of the thoughts from my colleagues across the aisle and talk about some of the great things HHS has actually done. They've established their MAHA program to address the chronic epidemic that this nation faces. 60% of Americans have a chronic disease. We're spending 90% of our healthcare dollars fighting those diseases. They've banned many of the artificial dyes. They've enforced executive orders on healthcare transparency and prior authorization issues, both of which need to be codified by Congress. I welcome their research on autism. They've banned irreversible surgical mutilation, which is basically sterilization of children. Their Operation Stork Speed has enhanced infant formula safeties, and that's just the start. I want to quote Secretary Kennedy. This is from an April 6, 2025 social media post. The most effective way to prevent the spread of measles is the MMR vaccine. That's not me saying this. This is Secretary of HHS, Secretary Kennedy. The most effective way to prevent the spread of measles is the MMR vaccine. Let's start with Dr. Adams. Dr. Adams, in your role at ACF, just paint the picture for us. What are you excited about? What can you move the needle on in your area?
Yeah, Senator Marshall passed this prologue where I intend to spend a disproportionate time of my energy and a disproportionate amount of my effort is improving child welfare, specifically the foster care and adoption systems. Beyond that, the other largest programs at ACF, TANF, working to ensure it is a hand up and it helps on a path of self-sustainability, early childhood education, as I said, promoting and strengthening Head Start, as well as the Child Care Block Grant, making sure it works for parents and for families are going to be areas that I intend to spend my time and energy on.
So how do you do that? How do you move the needle? What did you do in the past that moved the needle to make that happen?
Focus on data, as I showed with Senator Grassley and Hassan. If you walk into any of our offices across the state, you'll see what our ratio of foster homes to children is. So having a compelling scoreboard, measuring it, pushing it out, aligning incentives within the agency, I think are things that are really important.
Okay. Mr. McCarron, let's go to you next, if you don't mind. You've talked about the moral imperative of economic growth. In your view, what are the most promising Treasury tools to spur sustainable growth for the future? What's at your disposal to help grow this economy?
Yes, Senator, thank you for the question. Within my domain and domestic finance, I think the single most important thing we can do to drive growth is to revisit the financial regulatory system to ensure it's actually well tailored to the goals we're trying to achieve with financial regulation, safety and soundness, financial stability. I think more concretely what that really means is we need to ensure that our requirements reflect the latest and greatest understanding of the actual risks that we're regulating. So for community banks, I think we need to revisit the tailoring of our regulatory framework coming out of the financial crisis, ensure that it really is fit for purpose, right? That it reflects the unique lower risk profiles of community banks. We need to revisit, like I discussed with Senator Langford, our deposit insurance regime and make sure that it also has a level playing field for community banks. And then we need to extend those same kind of principles to the capital markets, to the housing finance markets. Again, the guiding principle here is modernizing regulatory requirements so that they're aligned with risk. This is not about weakening requirements. It's about ensuring that we have a system that achieves safety and soundness, mitigates risk to financial stability, protects consumers, and does that efficiently and fairly.
Okay. Why don't you take that just a little bit drill down a little bit further what that looks like? How would you implement that? If you're a community banker and I'm talking to my folks, friends back home, what would you say to expect then out of the administration to make that happen?
Sure, Senator. So I would commend Acting Chairman Hill at the FDIC for just putting out recently a proposal that would index some of these dollar thresholds that trigger heightened supervision. Many of those were set years, if not decades ago, and have not been indexed to inflation. His proposal would achieve that index. I think that's a great concrete step in the right direction. Similarly, we should revisit the deposit insurance framework. Okay. I think that's one thing we should modernize. And then what I hear from community banks is that much of the burden is on the consumer compliance side and the anti-money laundering side. I think especially on AML, anti-money laundering, there's a real opportunity there to ensure that the regulatory scheme is truly aligned with the national security priorities, that banks can allocate risk from lower risk activities to higher risk activities. Believe it or not, this was actually a controversial statement in the last administration. Some of this is just basic common sense, but I think if we execute and implement on it, it'll really drive the ability of banks to do what they're supposed to do, which is lend to their communities.
Thanks. We ran out of time, but I also take a look at it. It seems like there's just one regulatory group after another in the banks asking the same questions, and it's just taking time away from other good opportunities in the banks. Thank you so much. Mr. Chairman, I yield back.
Is next.
Thank you very much. Mr. Adams, welcome to you and to your family. I am a product of good public policy. I know what happens when we get the federal public policy right. I'm a proud alum of Head Start. Head Start provided me and millions of others a great education and a strong start in life, and if confirmed, you would oversee Head Start, which serves over 800,000 children and families, 23,000 of which are in my state of Georgia. In April, HHS closed and consolidated 5 of the 10 regional Head Start offices. I'm hearing from providers in Georgia that these closures have resulted in reduced access for those children and their families. And that's why in April I sent a letter to Secretary Kennedy demanding answers. Sadly, I've yet to hear a response. Mr. Adams, I know you weren't involved in this decision. You stand before this committee seeking confirmation. But if confirmed, will you ensure that I will get an answer to my letter within the next 30 days?
Senator, first, let me just say thank you to your staff for opening their doors to me a couple weeks back and spending some time to get to know me and my positions for ACF. I'd reiterate what I said in my opening statement. Head Start is one of the priorities I want to focus on. My wife, who's here today, her grandmother ran a Head Start in Blackfoot, Idaho in the late 60s and early 70s. Establishing a line of communication, ensuring that Head Start grantees across the country have access to the information they need when they need it is something that's important to me, and I look forward to working with you on that. In terms of legislative response, as you said, I can't speak to what's happened at the agency today. I'm not there
today. My question is, will you work to get me an answer to my letter within 30 days after you're confirmed? That's my question.
Senator, legislative responsiveness is something that's always going to be important to me. I will ensure I can get you a response as quick as possible. As the nominee, I don't know all the sign-off processes internally at HHS, but I commit to getting you an answer as timely as possible.
You've testified that you will support Head Start and work to ensure the program's success. How will you ensure the closures of regional offices do not further disrupt access to Head Start for families? I'm hearing from providers that it has disrupted services.
Senator, so well, I'd reiterate what Secretary Kennedy said, which is his intention is to make Head Start better and brighter by the end of this term. One of the things, I run the Idaho Department of Health and Welfare. Head Start grants don't go through us. I have a Head Start collaboration office, but they're private entities and nonprofit entities. To the extent that they don't have a line of communication, I'd be happy to work within the agency and set that up.
So my question is, what will you do to make sure that these terminations aren't disrupting access to Head Start? You said you're a big supporter of Head Start. I would think you would be working hard to make sure that we don't have disruptions in services. We've seen the Trump administration in a very reckless way, whether we're talking about the CDC or other agencies, fire a lot of people across the board. And we know it's reckless for a whole range of reasons, but they've had to admit as much when they've had to go back and rehire some of the people they fired, saying, oops, we didn't quite know, let's try to push that button. So I don't want people taking Head Start lightly. I'm sitting here today because Head Start lived up to its name. It gave me a head start. So if you are confirmed, will you commit to reviewing these terminations decisions, and will you report to this committee on the Office of Head Start's current ability to fully function and serve providers and families? That's a yes or no question.
Senator, my job is to follow the law. So if errors have been made, I would look to correct those. But my job is to follow the law and ensure that all legal obligations related to Head Start are being fulfilled.
Well, I'm not asking. I'm glad to hear that you will follow the law. That's an important answer. But I'm asking you about these terminations and their impact on Head Start operations. We've seen what happens when they push this button without taking stock of what it will actually do. So I'm asking you that will you review the terminations and then report back to this committee whether or not you think it's working? That's a management question.
Yeah,
yes or no?
Senator, I'm happy to look at it.
Will you report back to the committee? How will I know you've looked at it? Will you report back to the committee? I think it's a simple question, sir.
Senator, legislative relations is really important to me. I will follow the internal practices to ensure that I am working with the legislature as expected.
In your answers, I feel the pressure that you feel from the administration. I hope you will take account of what the people you're pledging to serve are actually feeling. Thank you very much.
Senator Cortez Masto.
Thank you, Mr. Chairman. Dr. Adams, in conversation with Senator Lankford, you talked about the number of missing children, unaccompanied children that had come across the border in previous administrations. Can you agree to provide data on the number of children missing when you get into that position and what your agency intends to do about it? Will you provide that data and that information to my office and Senator Lankford's office?
Senator, as the Secretary has noted, finding those children is going to be paramount. The dangerous policies of the previous administration.
I heard you say that. All I'm asking is for you to provide us with that information. Would you agree to do so?
Senator, to the extent that information lives within the agency, I'm happy to work on reporting accurate data.
Thank you. Just recently, President Trump and the Republicans passed a reconciliation bill that cuts $20 to $30 million from Nevada's children behavioral health services over the next 5 years. These cuts will hurt kids in foster care or with serious mental health needs, including programs that provide family therapy, crisis response, and care coordination. Much of Nevada's Medicaid is paid for, much of Nevada's program is paid for by Medicaid, and it's carried out in partnership with the Administration for Children and Families. Given these cuts, what steps will ACF take in coordination with CMS to sustain its and help sustain Nevada and really across the country behavioral health programs for children in foster care?
Senator, well, a couple things. I would first note that the Medicaid cuts, I would reiterate what the administration has said. The intention is not to have any impact on the core constituency. But
it is. So what do you
Medicaid.
intend to do to help us address those cuts and make sure that we're not having an impact, negative impact on our kids, both in foster care, but also their behavioral health?
Yeah, so Senator, the way I view my role is I have about 60 programs assigned to me. I want to skillfully administer those within foster care in particular. I think an area to lean into is the 4E prevention services, where it is an additional source of funding available to states to provide effective prevention for substance use disorders, mental health, and related things. I want to make sure that there's no red tape and that states are able to build out robust prevention plans so that there are services available to families at risk of entering foster care.
Okay, so if confirmed, you'll commit to using all available ACF tools and working with CMS to help Nevada sustain its children's behavioral health services?
Senator, CMS is a separate operating unit that doesn't fall under the jurisdiction of ACF. I do see my role as working closely with Dr. Oz and CMS.
Good, that's all I need to hear. That's all I need to hear. I only have so much time. Let me move on here. You've had a lot of conversations with my colleagues about Head Start because this administration has really taken an axe to Head Start and blocking nearly $1 billion in approved, let me just say approved by this Congress in a bipartisan way, Head Start funding this year. And you've talked about the Secretary's position on Head Start, which is he wants to have a better, brighter, make it better and brighter by the end of his term. What does better and brighter mean? I'm confused.
Senator, I have not had conversations with the Secretary about that, so I'm operating off of publicly available information as the nominee.
What would you bring to that conversation of better and brighter? How do you think it could be better and brighter?
I think the congressional justification submitted with the budget hits nail on the head. More parental engagement, better nutrition, more of a focus on healthy lifestyle. I think there's quite a few things that can be done to improve Head Start. The thing that excites me about ACF is how all of these programs work together. And I saw a study that Head Start engagement reduces participation in the child welfare system by 93%. So I think creating synergies across ACF programs is something that I'm really going to focus on.
Thank you. Thank you. I only have a minute left. Mr. McKiernan, let me ask you this. Do you believe tariffs are a tax?
Senator, I'm nominated for the role of domestic finance. The tariff and trade policies outside my domain.
You don't have a position on where tariffs are a tax? You're going to be in the Department of Treasury.
Senator, I intend to stick to my role here at domestic finance if I'm confirmed.
Do you believe that is important for the Federal Reserve to set interest rates independent of any interference from Congress or the President, even if the politicians and pundits are unhappy with monetary policy?
Senator, as the Secretary said last night, monetary independence is a cornerstone of our economic prosperity.
So according to Commerce Department estimates, our nation's real GDP fell by 0.5% in the first quarter of 2025. This marks a sharp drop from the 2.5% positive growth rate in Q4 of 2024, and it's the first time the American economy has contracted in 3 years. Are you concerned, given these troubling economic growth indicators, that it is a bad time now to be running up the federal deficit by trillions of dollars?
Senator, I'm very optimistic about the path of the American economy. The President's leading on a pro-growth agenda, and I'm very, very excited to be a part of that.
I know I'm over my time. Thank you, Mr. Chairman.
Thank you. Senator Welch.
Thank you very much, Mr. Chairman. And Dr. Adams, I want to ask you a few questions. I understand you're from the great state of Idaho.
Yes, sir.
Should we? You know that guy? Thank you. LIHEAP is an incredibly important program. It's getting zeroed in the budget. I know that you played a major role in Idaho in administering the LIHEAP program there. It's really, really important in Vermont in those cold winters. I mean, what's your view on zeroing out the budget for LIHEAP?
Well, so Senator, as the nominee, I'm not involved in any of the budget discussions that have occurred to date. My understanding from the congressional justification is that the Trump administration...
I'm not asking you what the congressional justification is. I'm asking you your position on zeroing out a program that you administered in your state of Idaho and presumably thought was beneficial to the citizens of Idaho. That's what I'm asking.
Senator, I would characterize my position as similar to what the Secretary has told the Senate, which is LIHEAP, the administration is trying to lower energy prices for all Americans. If that doesn't happen in Congress.
No, look, you spent a lot of your professional career helping folks who needed low-income heating assistance. So you have a view about the program. You committed yourself to the administration of this. So I understand you're not the boss in terms of what the overall budget is, and you'll have to go along with the program. But I'm asking you, as a person who did really good work for the people of Idaho, administering the LIHEAP program, what do you think about zeroing out that program?
Senator, I'll reiterate what the Secretary said. If Congress funds it, we'll get the money out the door.
But the president is zeroing it out, and you're not in Congress. You're not working for Senator Crapo. You're working for President Trump, right? So my question goes back to, what's your view about zeroing out the LIHEAP program?
So as a former state budget director, I would say no budget decision is ever made in a vacuum. It has to look at the total picture. And because this is an administration that's committed to energy policies, more permits than any administration.
So you won't answer, basically. You know, when you started talking about the market, the whole point of LIHEAP is it's people who don't have the resources to participate in the market. They have no control over A, the weather, and B, the price of home heating fuel, right?
Senator, I think, in states like mine, we have policies that prohibit shutting off of utilities for certain critical months. I think you're going to have to take into account the nuances and all the other factors in the market.
I'll just say candidly, I really admire the work you did in Idaho on the LIHEAP program, among other things, and I'm really disappointed in from my perspective, lack of candor about what your view is about zeroing out a program you worked really hard on. Mr. McKernan, my colleague from Nevada was asking you questions about the debt, and interest rates are persistently high, and you're talking about pro-growth. Everybody's for pro-growth, but isn't the debt of $37 trillion an impediment to growth?
Senator, I think the idea here is to use growth to drive changes to the debt dynamics. We've got to grow the economy faster than we grow the debt.
No, I get that, but I'm asking a basic question that a lot of very serious economists are concerned about. Some Republicans, some Democrat, and that is we've got about $37 trillion in debt. We just passed a bill that added $4 trillion in debt. And is it your position that there's no problem with that, or it can easily be solved by just making up an aspirational goal of higher growth?
Oh, no, Senator. My position is that we have a fiscal trajectory that is not sustainable, and indeed is really a test of our national character, how we deal with our fiscal challenges. But I'm suggesting that growth is a central part of our path to the solution.
Well, I'm pro-growth. I think everybody on this committee probably is. How we get there is obviously a debate. But our debt service in 2021, first quarter was $700 billion. In the first quarter of 2025, it was $1.114 billion. And it's going to be higher than what we spend on anything else in government very, very soon. Is that a concern to you?
Senator, the growth in interest expenses is just another indicator of the fiscal unsustainable path that we are on, and we've got to address the debt dynamic.
And it was made more intense by the passage of the recent legislation. I see my time is up, Mr. Chairman. Thank you for your consideration. Thank you, sir.
Thank you, Senator Lujan.
Thank you, Mr. Chairman. Mr. Kernan, are you suggesting that the beautiful bill that just got passed is going to grow under President Trump more than the $3 trillion, $3.5 trillion in debt that it created?
Senator, what I'm trying to suggest is that tax reform was a critical...
Okay, it's not a yes or no. Okay, that's fine. I appreciate that. Before I get started, Mr. Chairman, first I want to just say thank you to the witnesses for being here today, witnesses nominees for being here today. But before I get started, I ask unanimous consent to enter into the record a ProPublica article. The article explains that the Internal Revenue Service is building a system to share millions of confidential tax records with the Department of Homeland Security, an action which is in violation of U.S. taxpayer law.
Without objection.
Mr. Chairman, when the IRS commissioner, when Mr. Long sat before this committee, several of us asked a very specific question, and his response to them was, quote, "I don't think anyone's taxpayer data should be released to anyone," and quote, "I'm going to follow the law wherever the law takes me." Mr. McCurtain, I would argue that the IRS commissioner is not living up to his word. My question to you is, if confirmed, will you stand up for taxpayer privacy and follow the law?
Senator, yes, if confirmed, I will follow the law.
Mr. Adams, Head Start provides critical early childhood programs and helps make childcare safer and more affordable for families across the country. Would you agree?
Yes, I agree.
You know what Head Start is?
I am familiar. As I said to several of the other senators, my wife, who's here today, her grandmother ran a Head Start program in Blackfoot, Idaho in the late 60s, early 70s.
Well, thank you for doing that. I'm one of 2 senators that went to Head Start. I thought everyone got to go. I didn't know I had to qualify for being poor. So thank you for doing that for families that need it. Is it a program that you'll support?
I would reiterate what the Secretary said. He wants to make Head Start better and brighter by the end of this term, and I share that commitment.
You got family behind you that started the program. You'll support the program?
I am committed to making the program better and brighter by the end of the term.
Let me try one more time. Will you support the program?
I support making the program better and brighter.
You can't say yes.
Senator,
will you support the program?
Senator, I think we're saying the same thing. I support the program and
I'll make it easier for both of us. I'll move on. At the beginning of 2025, the Trump administration was found to be withholding nearly $1 billion in Head Start. Are you aware of that?
I read reports about it, yes.
That's yes. You were aware then. You read the reports. I appreciate that. Over the last few months, a handful of programs have had to temporarily close due to funding delays or began shutdown procedures when grant funds and communication from the Office of Head Start were not forthcoming. As we can anticipate, this is impacting Head Start programs nationwide and forcing closures, which hurt children, teachers, and families. Your family would attest to this, and I, again, appreciate what they created. Now, I know the value of Head Start, as I shared with you earlier. My question, Mr. Adams, is do you know how many children Head Start served over the past fiscal year?
Funded slots has declined in recent years. I believe it's around 750,000 funded slots. It might have been over 800,000 in the previous fiscal year, though.
The number that I have is 729, but in that same range, so I very much appreciate your knowledge there. Yes or no, do you believe that it is acceptable for Head Start programs to face layoffs or closures due to federal funding delays?
Senator, my commitment is to get funding out at as appropriated by Congress timely. I understand Head Start have thinner margins than state agencies like mine who receive lots of federal grants. I do think additional priority and emphasis needs to be placed on them.
So, Dr. Adams, when Congress appropriates money and takes action in the House and Senate to appropriate money for Head Start, you'll push back against Russ Vought and others that try to take that money away?
Senator, my job is to follow the law.
Is that a yes?
My job is to follow the law and the appropriations authorized by Congress.
Do you think Russ Vought is following the law today with his rescission initiatives?
I'm not familiar enough with the rescission decisions.
If Congress appropriates money, is it the executive branch's responsibility to follow the law and administer those programs as Congress passed them?
So, Senator, I guess I see my job as following the law. I'll work with my Office of General Counsel and others to do so.
Dr. Adams, will you keep your word? When you say you'll follow the law, will you keep your word and follow the law?
I will follow the law, Senator.
I hope that you keep your word. It's incredible to me how in this town, folks will come before this committee, they're under oath. Secretary Kennedy was here and said he'd respond to us in a timely way. I've been after him for like 5 months now to respond to a letter that a bunch of Democrats and Republicans have signed on to regarding measles. He's not done it. All we can ask is that we do the best that we can. You're outstanding individuals. I just hope that people can keep their word and that the careers that you all have had, the LIHEAP program that you're so proud of, that this administration doesn't put you in a position where you have to jeopardize your character, y'all. We have different ways of getting there to help people. I respect that. Protect the character you've established by helping others and doing the great things that you said you would do. I certainly hope that I see you do that, and that we can get through some of this. Look, I was raised on a small farm. Simple yes or no is what my dad would expect. Once I started going on and on and on and on, my dad would quickly tell me the cover-up is worse than the lie. I certainly hope that we can just be honest with each other. And when the answer is yes, we should be proud and say, yes, yes, I support those things. Or no, can't do it that way. And then we can talk about it a little bit. So, Mr. Chairman, I thank you for the indulgence here and, wish you all luck, pray for you. And please keep your word protect your character as you do your jobs that you will be confirmed to do. Thank you.
Senator Smith.
Thank you, Senator Crapo and Ranking Member Wyden. And I want to just associate myself with the words of my friend and colleague from New Mexico with regard to the importance of Head Start. And thank you, Senator Lujan, for that. I appreciate it. Mr. McKernan, as you know, you and I spoke with one another when you were nominated to be head of the Consumer Financial Protection Bureau, and I just want to understand a little bit. That was at a banking committee hearing where we had a chance to talk about your nomination along with others back in February, and all nominations were reported favorably out of the committee the following week, and then after that, your nomination wasn't moved forward in the Senate. And so I'm wondering if you could just explain to us what happened with that, what happened with the CFPB nomination, and kind of what's the backstory there?
Senator, I don't have any insight into that. I'd have to refer you to those folks who make the decisions around priorities on floor time.
Well, it's just curious to me, and I'm wondering. We've had lots of concerns about what Director Russ Vought is doing to dismantle the CFPB, and I'm wondering if you think that has anything to do with it. I mean, what is really going on? Do you have any insight into what's going on there?
Senator, I don't have any insight into what's going on there. I will just say that I'm very excited by and honored by the Treasury nomination. This is a role that's very exciting to me, an opportunity to really continue public service and contribute to welfare of the country.
At your last nomination hearing, you referred to yourself, I believe, as an Article 1 guy, referring, of course, to Article 1 of the Constitution, which established the legislative branch, correct?
Senator, that would sounds like me. I did spend quite a bit of time as a Senate staffer.
And in pledging to ensure that the CFPB would continue to perform its statutorily obligated function under your leadership, you said the North Star here is that you've got to follow the law, fully and faithfully execute the statute. I'm not trying to play gotcha here. I just wanted to make sure that that's what you said in terms of following the statute and the law.
As my wife reminds me, I do say North Star a lot, so yes, that does sound like me.
And so as you think about this role that you're currently nominated to undertake, you can understand maybe why some colleagues on this side of the aisle have some concerns about how nominees will follow the law when they are directed to do otherwise by the administration. I'm wondering if you could just comment on how you see this, how you see your role in this position that you've been nominated for as an Article 1 guy.
Senator, so I'm nominated to be the Undersecretary for Domestic Finance. If confirmed, I'll have oversight, or I'll have a role in policy relating to the the financial regulatory system and federal finances. As I think about that kind of at a high level, the goal here is to have an efficient and fair financial regulatory system and to have an efficient federal finances. That's kind of how I think about the approach here. And of course, if I'm confirmed, the starting point is high fidelity to the statute, to the law. That's where you start and you work from there.
So thank you for that. I want to just again, I think, associate myself with the comments of Senator Lujan that it does seem that many Trump administration appointees find themselves between a rock and a hard place when it comes to what the law says versus what the administration is directing them to do. And I don't expect you to respond to this because, I get how this works. But I think that all of us on this committee will be looking to hold you all to that high standard and in some ways sort of the foundation standard that everybody in this administration or any administration should be able to live up to. Thank you, Mr. Chair. I yield back.
Thank you. Senator Blackburn.
Thank you, Mr. Chairman, and congratulations to each of you on your nominations. Dr. Adams, if I can come to you. 60% of child sex trafficking victims end up in the foster care system at some point, and many of these children, what we have learned, will undergo numerous interviews from Child Protective Services before they are ever placed or given appropriate services. And these interviews are absolutely so traumatic for these children. I think this is an area where we need some transparency, we need some accountability, and I have the Gracie Act that we are putting in place to make certain that we are recording these so that the child is not having to constantly relive this. So as Assistant Secretary, you're going to have the opportunity to design a more comprehensive system. And I want you to speak to how you would elevate this work within the Children's Bureau to make certain that these children are going to be protected and helped through this situation, and that the offenders are going to be held to account in a more efficient way and also more quickly.
Well, Senator, first, let me just say thank you for your advocacy for this issue. I know you've done a lot to protect children from trafficking and ensure that they have the resources. Look forward to working with you on that if confirmed. One of the things as I was studying this budget, it's about a $70 billion budget. The Office of Trafficking is somewhere between like $20 and $30 million. So it's a very small piece of the agency's overall pie. So I think integrating it into the work of the child welfare system is something that's going to be critical. It's an $11 billion system versus a $20 to $30 million program. To the extent there is ideas that you have, I'm happy to work with you on those because I share your commitment to wanting to protect these children.
Have you previously done much work in this area?
Senator, I haven't had much direct experience with this. I have met with Idaho's Trafficking Coalition and others to prepare for this role, but I don't have too much direct experience specifically.
Thank you. Mr. McKernan, I want to visit with you a little bit about digital asset innovators. You know, Tennessee has become quite a hub. We've got several Bitcoin mining operations that are there. We have some of the hyperscalers that are there. Bitcoin Park is actually located in Nashville. And we are increasingly hearing from these individuals that are innovating in the digital asset space that they're concerned about Operation Choke Point 2.0 and the broader trend that there is of debanking, where a financial institution begins to feel pressure and they directly or indirectly feel and begin to apply pressure to others and deny services to lawful businesses in the digital asset space. So these are valid concerns. They're valid concerns to innovators. And talk to me about what you would do to ensure, both in the supervisory and the regulatory space, that we are making certain that there is a level playing field for these legitimate digital asset businesses.
Yes, thank you, Senator. Debanking is certainly a challenge we need to address. It's wrong. It needs to not be something that the regulators are driving. And I think two approaches that Treasury, I think, should consider encouraging the other banking regulators to also look at. First, it gets a bit technical, but I think there's been a practice where the bank regulators, the bank examiners, have used reputation risk as a way to encourage, even require banks to debank otherwise lawful businesses. Already, this administration has encouraged the removal of reputation risk from the supervisory framework. The banking regulators have executed on that. No longer should reputation risk be a basis for supervisory criticism. I think that's a big step forward. There's more work to be done. I think part of the rest is really around changing the culture of supervision. That's two parts. We need to be clear about what the supervisory policy is, namely that banks are encouraged to bank lawful businesses. There's certainly no expectation to not bank lawful businesses. And then second, maybe even more importantly, is that we have a process for monitoring examiners' compliance with that supervisory policy. It's not just it's not enough to just have it on paper. You got to trust but verify. And I think that's something that the banking regulators should look very seriously at, is again ensuring that they have a program for monitoring their examiners' compliance with the supervisory policy here, that banks may and indeed should bank lawful businesses.
Thank you. Thank you, Mr. Chairman.
Thank you. Senator Warren.
Thank you, Mr. Chairman, and congratulations on your nominations. So FDIC insurance is limited to $250,000, and above that, customers with bigger deposits are supposed to wait in line and hope that they can recover a portion of their funds when a bank fails. In March 2023, Silicon Valley Bank and Signature Bank both blew up, creating the third and fourth largest bank failures in American history. In order to prevent additional bank runs and a full-blown financial crisis, the Fed, FDIC, and Treasury took the extraordinary step of guaranteeing all uninsured deposits at those banks. That meant that huge companies like venture capital firm Sequoia, crypto company Circle, and electronics company Roku had billions of dollars in deposits, and they didn't lose a penny when those banks failed. FDIC made good on all of it. Now, I want to contrast that, as Senator Lankford did, with the treatment of two small bank failures in Oklahoma and Texas in the years after SVB crashed. Local small businesses like pharmacies, grocery stores, and construction companies that kept their payroll and other money at community banks got $250,000 in FDIC coverage and lost millions of dollars in the uninsured balance. People understand which banks will and won't get bailed out if there's trouble. In the week following SVB's crash, $100 billion in deposits left smaller banks, while largest banks saw $120 billion in new deposits. So, Mr. McKernan, you were a board member at FDIC in 2003 when SVB and Signature collapsed, and you saw some of those dynamics up close. Has it become clear to the market that in the event of failure, depositors at giant banks will get fully reimbursed while depositors at small banks won't?
Senator, I was at the FDIC during those events, and what I would say is, of course, by law, uninsured depositors are at risk of loss. There has been, I think, a developing market expectation to the contrary, at least with respect to large banks. The events around SVB and Signature may have tended to reinforce that market perception.
And can you explain the implications of this two-tier banking system on both the banking system and the broader economy?
Yeah, Senator, as the Secretary has said, he's focused on Main Street. And I think what that means as a practical matter for me is a real focus on community banks. And, on every Main Street, there's a community bank. All too often, that's a community bank under pressure from whether it's mounting compliance burden or, as you note, this market perception that may advantage the largest banks. And so I think a central issue for financial regulation today is how we ensure that community banks continue to play a role in the financial system of the future. That is an issue that's underscored by your question.
And particularly important because those community banks disproportionately are doing the lending to small businesses in our communities. So one way to help level the playing field is to increase deposit insurance limits for business transaction accounts, bank accounts that businesses use to make payroll and rent. Banks that benefit from the increase would pay for this expanded coverage ahead of time through their regular deposit insurance premiums. It would help smaller banks compete. It would also require big banks to start paying for some of this insurance coverage that they've been implicitly receiving for free. If small and mid-sized businesses are protected, this could also limit the government's impulse to bail out giant banks whenever they get into trouble. So, Mr. McKernan, this idea has received broad bipartisan support. Do you think that Congress should increase deposit insurance limits for business transaction accounts?
Senator, as I was discussing with Senator Langford, the Secretary's spoken on this and expressed a real interest in exploring an increase in the cap on deposit insurance for business payment accounts. Now, that would obviously require legislation that takes congressional action. But I did recently discuss this issue again with him. He's heard this issue over and over again from many, many, many community banks that he's met with inside Treasury, outside Treasury. I think the bottom line here is the Secretary would be very eager to see legislation to that effect to, again, move the cap up on deposit insurance for business payment accounts.
And can I count on you to work with Chairman Scott over in banking and me on getting that done?
Yes, Senator.
Okay, I appreciate that. The giant banks don't need another subsidy. This is about leveling the playing field so that our community banks really have a chance to do their good work in lending to local businesses. Thank you, Mr. Chairman.
Thank you, Senator Warren. We may have another senator or two show up. We're not sure. We had a series of 3 votes going on the floor. And so Senator Wyden and I we each have another couple questions.
Yeah.
And so we will each do another round, and then we will, if no other senators have shown up, we will wrap up the hearing. Senator Wyden.
Thank you, Mr. Chairman. And let me just say to you, Dr. Adams, as we kind of toed up the morning, what I continue to be very, very troubled about. First, you just flat out defended the actions Secretary Kennedy has made during the nation's worst measles outbreak in 30 years. Worst outbreak, 30 years. You say everything they're doing is just fine, and you're a pharmacist on top of it, which leaves me kind of slack-jawed. But that's number one. Number two, you said, and I quote, "I would be hard-pressed to find examples of regulations we've eliminated that have done harm." But you proudly talk about slashing continuing education requirements for nurses and preventing the nursing board from reviewing curriculum changes in nursing schools. That too, those nurses, they're on the front lines. They deserve the very best in terms of educational opportunities. You'll slash the rules. It's okay with you. But I think what leaves me most concerned is you told our staff that the Medicaid cuts only address fraud in the system. Those were your words to the staff, that the cuts affect only fraud. Now, every single kid in foster care is eligible for Medicaid. So when you cut Medicaid, you're directly cutting the health care for kids who've experienced, in many instances, extraordinary trauma. And I just don't understand how you basically can say that, cuts in access to therapy, developmental screenings, basic medical care they need to heal and thrive really isn't something that's going to be important to you if you're confirmed. So what I usually favor doing is I've made the points that I'm concerned about here, and I asked some questions that I felt were yes or no, and you've had lengthy kind of answers. We'll leave the record open. But those are the points that I'm concerned about, particularly today, is Robert Kennedy's role on measles and your support for that, the cutting of rules, and apparently your obliviousness to what Medicaid is really all about. And we had the auditors deal with those issues when people said, oh, it's mostly fraud and abuse. And the auditors came back and said it wasn't the case. Mr. Chairman, I'll use that as my closing statement.
All right, thank you very much. And then I will just probably respond to that and a few of the other things that have been said here, rather than ask you a question as well. So I'll just make a closing statement. First of all, with regard to the point that has been brought up by a number here, that the reconciliation bill that we just passed cuts Medicaid. It reduces Medicaid spending, but it does not reduce benefits for Medicaid recipients. It eliminates waste and abuse in the system, with several exceptions. There are some people who will no longer be able to receive Medicaid by the provisions of the law. One are those who are not American citizens and not legally in the United States. Two is people who are enrolled in multiple programs in multiple states. They are allowed only to sign up in one state. Three is those who become unqualified under the current Medicaid rules, but are not taken off the Medicaid rolls. The way that is accomplished is by requiring that status checks happen twice a year rather than once a year. And that way we identify those who are no longer qualified under current law and should be removed, and they are removed 6 months sooner than they would have had the bill not passed. Finally, there's one more group that may lose their Medicaid coverage. That is, we put work requirements, a very modest work requirement in the bill for those receiving Medicaid. It applies only to those who are able-bodied and do not have a child who needs care at home. And the work requirement is only 20 hours a month, which can be met by either doing public service or actually getting a job or getting an education. And if an individual chooses not to do that, then they would not qualify for Medicaid anymore. Most of the people who make that choice, and they estimate that some people will choose that, most of the people who make that choice will make that choice because they find that they can more easily get onto one of the exchange insurance programs for their health care rather than Medicaid. And so those are the people for whom Medicaid access is removed. That's none of the people that have been talked about in this hearing today. Anybody who's qualified for Medicaid, other than those that I just identified, is still qualified for Medicaid and still has the funding for it. And so that ought to be made clear. The second thing I'll close with relates to some of the questions that you got, Mr. McKernan, with regard to the fact that the big, beautiful bill increases the deficit by $3 trillion. I bet you've heard that 100 times or read it in the news. The reality is that the bill reduces the deficit. That may surprise a lot of you if you've been reading the news because they report it differently. The CBO, which scores the legislation on multiple occasions throughout the process of the bill. The most recent and final score by CBO shows that the bill reduces the deficit by $366 billion. It also shows that we reduce spending. The first time that entitlement spending has been addressed in this, well, not the first time it's been addressed, but the most significant reduction in entitlement spending, and I reiterate, wasteful entitlement and abusive entitlement spending. The biggest time that it's been addressed is now, and this CBO score indicates that this legislation reduced wasteful entitlement spending by $1.2 trillion. I think that's what most Americans want to see in terms of the national debt. And the fact is, they want to see us reduce our spending and increase our revenue. You were talking about growth, Mr. McKernan. The fact is, the bill is estimated to, the numbers I just gave you don't even account for the growth numbers that you were talking about. We're debating what increase in revenue to the Treasury will come that will further reduce the deficit by looking at what growth factors are in the bill. But nobody denies there will be growth in this bill because of the pro-growth tax policies that we passed. And if past is history, is any indicator, when we did these very same pro-growth policies in 2017, we saw massive capital formation and growth. Wages went up to record highs. Employment went down. Inflation went down close to 2%. And our economy was probably the strongest economy that any of us in this room have seen in our lifetimes. These are the pro-growth policies we put into place that are going to strengthen our economy. So I just wanted to have the other side of the story told as we deal with all of these accusations that simply don't accurately reflect the legislation. Again, I will say to the two of you, thank you for your willingness to serve. And thank you for giving us the time today to let all of our senators ask you the questions that they did. There are no other senators here to ask any questions now, so with that, this hearing is adjourned.